Order. We're live. Let's begin tonight with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. You may be seated. Can I get a motion to, well, let's do roll call first. Elaine Daly is absent. Stephanie DeVito.
Here.
Robert Shea.
Here.
Tom Winslow.
Here.
Can I get a motion to approve minutes from September 4th, 2024?
I'll move that.
I'll second.
I'm gonna skip over Brittany for now. I believe Denise is online. Denise, can you hear me?
I can. Good afternoon.
Good afternoon. Oh, yeah, come on up.
I thought that was, HHS was first.
No, we're first. Come on, join us.
I checked the agenda. They were
Sorry.
okay.
Elaine Daly is present and joining us.
Let's change it. Just-
Why is it not in it? I'm all confused.
No, where's JPS?
No, she's just up here.
JPS is first. Okay, I'm very sorry.
That's okay.
Huh? I'm all confused.
All right, Denise, go ahead. Thank you.
Okay, good afternoon. So I'm actually in Chautauqua County at our 911 coordinators conference, which is why I'm on Zoom today. And ironically, I just walked out of a dispatch stress course. And one of the highlights of the course that really hit me was one of the statistics that the presenter provided. Department of Labor did a survey of what they considered stressful occupations. And out of 873 jobs they surveyed, dispatch fell at number 8. I think I had to pick my jaw up off the floor at how impactful that statement was. And I'm actually going to ask the presenter for the slides because there was a lot of good data about stress and the impacts it has on dispatch staff and the things that we as leaders can do to help them. So definitely some good stuff happening here at our conference. As far as my report, just a couple of highlights. As far as staffing, we're currently short 2 employees. One position is dispatch.
Both say that.
One position is supervisor. So we're working on filling those, and I want to work with HR because I did have some conversations here at the conference about the help program, and I'm not sure that we're doing it like other counties. So I want to kind of regroup on that and see if we can move forward with that. Also, in regards to the backup center, Aileen did recently, the chair, schedule a meeting to talk about the backup center, which I think is good because it kind of leads back to that statistic of dispatch being, such a highly stressful position. And I know it weighs on staff too. What happens to us if something happens and the center goes down and we don't have a backup center. So, it's definitely a lingering worry for everybody that we need to tackle and move forward on with some kind of a plan. The Owasco Fire Department, as much as we tried to make that work, we're still having issues with the laptops from Entrado. I actually spoke to our rep today. She's here. Today's vendor day, so she happened to be here with one of the other technicians. We had a lengthy conversation about those. She promised me that in the next week we'd get somebody available to work through the issues that we're having with the laptops. They're not connecting back to the center, which means that basically they're not usable right now. So right now we have no kind of backup for if our phones go down, other than, sending staff to Seneca, which, it's not a great practice. We make it work, and, we'll continue to do what we can do. The radio laptops are still there. I did talk to Oswego today. They're done with so we can get that one back. That'll give us 3 to put back at the fire department. But I did just on the report, I did give you a couple scenarios just to kind of, think about if this happened, then this, and I don't need to, you can read those. And I do have one resolution for a microwave hop that is grant funded. This will not be impactful to our budget moving forward, and there is no cost to the county. It is all under our seat grant.
Denise, I have you for two resolutions. I have JP one and JP two.
I apologize. I don't have the agenda in front of me. Can you tell me what JP one is?
JP one is authorizing the chair of the Cayuga County Legislature to sign an agreement with Interaction Insight for maintenance of the recorder in the 911 center.
Okay, so that one was late and I didn't get, because I actually didn't get that quote until the day I did the resolution. And I didn't know that it was approved because it was a late resolution. So, yeah, okay, that one is a maintenance agreement for our recorder for the primary center. We implemented that last year with grant funding. It was a brand new recorder. And we do budget for that.
Okay, thank you.
Yep.
Any committee members have questions for Denise?
I guess you're just continuing to give us a heads up about the backup 911.
I am, because it does weigh, I'm gonna be honest, it weighs on me. And I know it weighs on my staff.
And when we were last month, I think we put Tom Bunn on the spot to see what you would have available here. And I thought last month, it really is right now Seneca County. Is that not what we ended up saying?
So that's the problem is there's no good answer. So Seneca County will work if our phones go down. We can send people over because our disaster plan says our phones, if they're not answered, roll over to Seneca County.
Yep.
They will answer our calls. But if our radio goes down and our CAD, our computer aided dispatch, if those go down, Seneca provides no help for that. So it's
And there's no
specific to phone.
answer. There is no answer to that at this point.
Correct.
Right now, you're working with the fire department, correct? And you have laptops
yes.
over there, and that's the temporary backup site?
Yes, but that could only so again, there's so many loopholes. The phone laptops do not currently work. Those are the ones that we just purchased. They're not connecting back. So that's been the issue with those laptops
Is that a vendor issue or is that our issue?
we don't know. We don't know if it's a connection issue on our end or if it's a vendor issue. And until we can get the vendor on site with our IT department, they got to troubleshoot it. Jeremy's done everything he can to try to get them to connect back and they're not connecting back. So, basically what I said to the vendor is I'm going to send them back. Send me a ticket. I'm sending them back, figure out what the problem is with them. I spoke to her today and she says that we'll get somebody, on them next week to get them configured and make sure that they're working.
Mr. Bunn, do you have something to add?
I would just say that, Denise, we can certainly talk about this offline, but that is 100% a vendor issue. As far as those laptops go within Toronto, we provide them the connection to the county, and then after that, it's their responsibility to make sure that it's connecting back to their.
Is that a software issue, Tom, or is that?
It very well could be. It could be an internal networking issue within Toronto that they have to work through, but.
Is that something that could be patched?
Oh, yeah. I mean, it can be rectified, but like Denise said, we have to get in touch with the vendor and make sure that they're on site, either correcting the issue on the actual hardware, on the devices themselves, or coming on site and.
And is that something your office can work with her on?
Absolutely.
Okay.
Have we asked them to come and they won't?
Got you, Tom.
Well, so the other issue is that our on-site tech that we have that's been phenomenal, he left the company. So they're in the process of hiring a new tech for our area.
So they're aware that they need to help remedy this.
They are absolutely aware.
And we can't remedy it without them?
No, really.
Okay.
Mr. Winslow?
All right, yeah, so, if we've identified it's not our IT, but it is a vendor. It sounds like it still has to be worked through with cooperation of your office as well as IT. And I guess, can I suggest that we make this a priority?
Oh, we have definitely made it a priority. The problem is, like I said, we literally last week, we lost our tech. So that's added to the stress of getting somebody on site.
All right,
You lost your tech, you mean your motor, what do you mean by that? You lost
In
your tech?
Toronto, our phone provider lost their
The
on-site
vendor's
tech.
tech, yeah, not your tech, the vendor's tech.
Yeah,
Okay.
we don't want to lose our tech.
All right.
We're just trying to identify whose responsibility is what, right?
All right, Legislator DeVito.
No, I was saying that Legislator Strong.
Oh, yes, I'm aware of that.
Yeah.
Yes. Anybody else from the committee? Legislator Strong.
Thank you, Mr. Chairman. So I want to be very clear for my own mind and hopefully everybody else understand this. So if you had a bad incident or something out at the current 911 center and the CAD system, our dispatch center, goes down, we do not have a backup. Is that correct?
We do not have an effective backup. That's correct.
And I'm trying to understand, is that a vendor issue or something we can remedy? If the vendor came and did what they needed to do, would that be effective? Even if it's not ideal to, I mean, I'm trying to.
You're talking about the Owasco Fire Department site, is that
Yeah.
correct?
Yeah.
What we currently have, there's a vendor issue that's standing in the way of it working.
That's correct. There's also the issue of having CAD over there. It's a small laptop. If you've ever been in the dispatch center, CAD is 3 screens in our center. So having a small laptop trying to dispatch from it from any length of time is not practical. The
No.
goal was to get some of the monitors out of the backup center and set them up so we could set up stations. Unfortunately, the networking from Owasco Fire Department back to the center and their limitations at the firehouse, we can't do that. So we need a place to set up a backup center for ourselves.
Madam Chair.
So this is new information, a couple things. It's October 2nd. I'm not aware that the laptops at Owasco aren't currently up and running. We purchased those laptops for the backup center. We've been told it seems to be, that was our contingency plan. Our next contingency plan is if we cannot answer calls, they're rolled over to Seneca County and dispatched in that way. Why you're shaking your head no? That's not true? Mr. Strong?
I don't believe it's an option, but I would have referred to the expert.
My understanding is that when the phone lines are down, the phone lines run over to Seneca County. They use laptops to communicate back to our current 911 center, and our current 911 center dispatches the call through their CAD system and the radio system in the current 911 center, which excludes any conversation about the backup system itself. Am I got that narrowed down, Mr. Bund? Yes.
That's how I understood it.
Right. As far as the laptops go, my understanding is that current conversation about the laptops is about the ones we purchased and should be operational at the Owasco Fire Department, which was our backup plan, our contingency backup plan in the process of us working through finding a new temporary backup site from the cop. So the fact that they're down, this is news to all of us, I believe.
So again, I'm gonna repeat my statement that if we have an incident of some sort at the back or at the current center, and we cannot dispatch from that center, do we have the capabilities of a backup dispatch center, dispatching?
We currently have 2 laptops at the Owasco Fire Department that are Motorola laptops that we can dispatch from. But keep in mind, we have 6 consoles at the primary center, generally 4 to 5 are manned. So we can only dispatch from 2 laptops. So for a short period of time, we could definitely make it work. But if we had any kind of large scale incident, we would be underwater.
So the answer,
Yes.
what I'm hearing, the answer is yes, is a backup system for a short-term amount of time, which would allow us time to get the main center back up and operational. Long-term solution would be different, but we're talking about a backup for a short-term amount of time would be sufficient based upon the information you're giving me. The answer is yes, for short-term, correct?
Once we get those phone laptops up for a very short period of time, yes, we could use Owasco. But there would be a lot of limitations.
But it will be functional and calls would be dispatched.
Correct.
Thank you. Any other questions? Any other questions for Denise? Denise, anything else?
Just, I had the second resolution. I don't know if you got through that first one yet.
You did not.
Nope. Can I get a motion to put JP 1 on the table?
Second.
All in favor? Aye. So moved. Denise, JP 2.
Yep, JP2 is to implement a new microwave link from
Thanks.
Auburn to, I'm sorry? From Auburn to Ovid. And this is covered under grant funding.
Can I get a motion for JP2?
I'll move it.
Second.
All in favor?
Aye.
All right, so moved. Anything else, Denise?
That's all. Thank you.
All right, thank you very much. Enjoy your conference.
Thank you.
Wait a minute.
Is Mr. Hopkins with us today? Oh, no, you're with us. Come on up. Sorry about that.
Good afternoon.
Good afternoon, sir.
So you have our report, not much out of the ordinary on there. I did want to quickly address two matters. One, the report does mention our search for office space, which has been an issue for a few months now. Don't have anything, don't have any conclusions to that report yet, but we are working with Steve, with Kareen, and I'm optimistic that hopefully back here a month from now, that there may be a resolution to that.
I'm optimistic as well.
Also wanted to address that next month, it looks like we're gonna have to present a resolution. Just to give you a heads up, I think our funds are running out for the year. Obviously, this year was a bit unprecedented in terms of you're assuming what our budget was going to be. This is our first full year with the increased rates mandated by the state. And it looks like we've managed to go a full 11 months with what was budgeted. I think we're gonna have to ask for some more.
What do you think you're gonna be asking for?
I mean, I don't have the exact figures with me, but I think we're looking for somewhere in the vicinity of about 200,000. Before our next meeting, before we present that resolution, obviously we'll have that information.
And none of that is state reimbursed at this point?
It's over the allocation.
It's over the allocation, right? Yeah. Okay.
Can I ask a question?
Yes, ma'am.
I think at one point Lloyd had agreed on with the projections that Lynn and Grace did that this year it would be really tight. If not, you'd run out of funds. I heard though that next year you have additional resources coming in. I got the impression that Lynn had said for the 25 budget, things were looking better in terms of increased revenue. Is that your understanding?
I believe so, and I apologize, I don't have all my
Okay.
figures with me today.
But that doesn't help us in this year.
Correct. I mean, I'm optimistic that next year, first of all, this year at least gives us a baseline idea of how this works now with the rates. So I'm optimistic that things will go a little more smoothly next year, although I think we've done, I think all things considered, the fact that we've gone this long is working out pretty well. But yes, I'm optimistic next year will be
Thanks.
more smoothly.
Anything else? No questions?
Mr. Chairman?
Yes.
Mr. Price, if you can wait like 5 minutes after the meeting, I may have an update for you.
Okay,
Okay, if not, give me a call tomorrow and we can walk through some stuff,
sounds good.
whatever works. Thank you.
All right.
Thank you very much. Dr. Duckett is not here. Tyrone?
Yeah, to get no resolutions.
Oh, no.
It's been pretty steady, with our workload here. Policies and procedure manual is done. We're pretty close to, being in compliance with everything now, as far as what the state mandates from us, and so we're definitely moving in the right direction and getting where we need to be, so.
That's great.
You made a lot of progress this year and then we all appreciate it. I think you're doing a great job.
Yep.
And have those new vests come in or are they still, they're on order,
Not
right?
yet. We're, called to check on him and, he hasn't really given us a definitive date, but we know they're coming.
They take a little time.
Yeah.
Any questions for Tyrone? Yes.
I was just curious, you're looking to offer 2 youth groups,
Yeah.
boys circle and girls circle. Could you?
So they're basically for our girls and boys. Basically, it's a group that we facilitate, but kind of more focused, the kids run the group itself. And
High-risk youth or just regular youth?
And we'll be taking referrals from the high school, anything that the sheriff's department may have, you know.
It's not like Scared Straight.
No.
No,
It's more of,
I do know.
it's more to, that kids can talk and be able to help each other. And there's lesson plans and things like that. So, we sent, one of our officers, our youth officer got trained in it. It's something that we thought was gonna be pretty beneficial to help with, recidivism and maybe stopping, kids from going from the juvenile side to our adult caseloads.
Do other probation departments have similar groups?
They do,
Uh-huh.
they do, we have never had one,
Mhm.
but I think there's a lot of benefit to it and it also looks good in our annual plan as well, so.
Like preventive, really, yeah.
They show good results.
Yes, you know.
It's like peer building and stuff as well.
You know, when we talk about it at COPA and, directors meetings, it seems to, like, people have good results in other counties, so, we're gonna give it a shot and see how it goes, and, you know, hopefully, you know, we can start a couple other groups, once we get this going and see how it goes, but we're right now just trying to find a space to use. We thought maybe we might be able to use the high school, but I don't know, it's hit a little snag there, so we're still looking and the high school still may work, but we'll find something.
Any other questions from Mr. Thomas?
Nope.
Thank you, Tyler. Thank you, Tyler. Appreciate it. I believe the sheriff's online tonight. Hello, Sheriff.
Good evening. Can you hear me okay?
Yes, sir, we can. Thank you.
Good. No resolutions, just a couple of things to add to my report. I wanted to make you aware that the Finger Lakes SPCA unfortunately no longer has a humane law enforcement officer, so our law enforcement agencies in our community will have to pick up those cases. Anybody that's needing humane law enforcement will be reaching out to the 911 center, and our law enforcement members will be dispatched out to those calls. I am working with the SPCA to make sure that they can still help us with taking animals and certainly to caring for animals. We don't have the ability or the means to do that, but it looks like they'll be able to help us with that. They just won't be able to investigate those cases. So we'll be working on that.
Sheriff,
Are you, okay, I'm sorry.
Sorry.
Are you able to partner with the local, like, animal control for the townships as well? As far as taking animals?
I think as far as I know, the SPCA is able to help us with that.
Okay.
So I don't know that we'll need the local animal control officers. Certainly if we have an issue with capacity or the SPCA can't help for some reason, we would probably seek to get their assistance, but I don't know that that will be a concern yet. We'll just have to see how this goes as we move forward.
Okay, and I know Legislator Daley had a question for you.
was this part of the Tom Odessa work?
Correct. He stepped away. So now there's nobody there to do that work. In many communities, many counties, law enforcement does do that work already. We've been very fortunate here that we haven't had to do that, that the SPCA has primarily done that. But for the time being, I think that they plan to try to fill this position, but for the time being, we'll have to take care of that.
Because it is an obligation of law enforcement if there is no other way to do it.
It is. There's nobody else.
Yep.
Violations of law, certainly we'll have to take care of that.
Mm-hmm.
I want to thank the legislators that attended our tactical training today. I know it was very well received by our members. I appreciate you taking the time. Legislator Shea, Strong, Winslow, DeVito, and Chairman Ann, I appreciate you doing that today. The only other thing I wanted to mention, and I just want to make certain, I'm glad to hear there's going to be a meeting now relative to the 911 center, but I just don't want there to be a false sense that between Seneca County and 2 laptops at the Owasco Firehouse that we've got a really great plan. It's a plan that, you know, puts a Band-Aid on very seriously bleeding wound. It's not something that is a good alternative. It's something that we can answer a few calls with if something happens, but in the event of a major weather event or catastrophe, it's not a good plan. So I understand that we've got some challenges. We need to work through these, but I don't want there to be a false sense that this is a good plan that will allow us to go months and months here without addressing the need for a backup 911 center, because it's very critical. And I just hope that you'll continue to push this forward as a top priority. But I just wanted to give my opinion on that. I'm very concerned about our ability to dispatch our law enforcement and our fire and EMS resources in the event of a catastrophe. So I just wanted to mention that. I don't have anything else, but I'm happy to answer any questions if anybody has any.
No, I just wanted to let you know this is a priority for the county. It's a priority for this committee and the legislature. I just wanted to congratulate you. I know you mentioned in your report, but congratulations on the FBA grant of $850,000 for your programs in the jail. It's a testament to the work you've been doing and your presentation that you gave us last month. And I just want to say congratulations on that and continue the good job that you guys are doing there with your programming.
Thank you. I appreciate it. And it's a testament not only to our staff and our sheriff's office, but all of our partner agencies, certainly Cayuga Counseling and all of our service providers that have been helping us do this work. But we're one of 5 jails throughout the country that was awarded this pretty significant grant. So I think it is a true testament to the great work we're doing. And we continue to research the results with our research partners so that we have data as we move forward to determine, are we having a positive impact, and what are we, what kind of value are we getting for our investment? And I look forward to getting that data.
Any questions for the sheriff? Legislator DeVito.
Sheriff, I just wanted to comment on the tactical training this morning. So I just want to thank you for the invitation. It was phenomenal. It was a good couple of hours, very well spent time, and your team does amazing work. So I really thoroughly enjoyed it. So thank you.
Thank you. I appreciate it.
Jonathan, I just have one question.
Yes.
I just one question, just for my own clarification. We talked about your inmate population, and you talked that the state parole detainees, they're a requirement that the jail take parolees that are detained. Is that true?
Correct. So if a parolee is rearrested for a new crime, or if they violate the conditions of their parole, they do come to our facility, and unfortunately, we're not providing any funding from the state for housing them, but we're required to hold them.
And the 12 that you have were detained in our county. That's why they come to our county?
Correct. So any parolee
Okay.
correct. If they're violating their parole or rearrested in our community, then they come to our facility until, either their case is adjudicated if they're facing new charges, or a determination is made relative to the violation of their parole. They may go back to the state system, but until that time, we have to hold them in our facility.
Okay. Thanks, just for the clarification from my point of view.
And Sheriff, just real quick, back to 911. It's my understanding that the 911 center and the director actually presented a Wasco Fire and that solution to us. I mean, that was presented to this legislative body.
Yeah, I think it's just important that it's a very minimal solution. And from what I'm seeing, in my opinion, when you look at, as she said, that when you have multiple stations at the primary site, but we only have 2 when they're working at the backup site, I just want to make sure that there's not a false sense that in a major incident, again, major weather event or major incident, or catastrophe, if we lose our primary center, there's a lot of agencies that are going to have to be dispatched from those two little laptop stations, or even 3 if we have 3. It's not going to be equivalent to our primary center. So I think it's really important that we keep pressing this thing forward as a top priority.
I agree with you, sir, but I do agree with you. And but to the point that, I mean, this was their plan presented to us, and if they have, and again, we'll talk to Denise as we move forward, because this will come up in discussion, but if they have concerns as well, we need to come up with a better plan, I guess. And again, this was their presentation, so.
Well, I think that's why it's important that these meetings sounds like there's a meeting scheduled, but these are critical right now to move this forward in a positive way.
Chairman?
I was talking earlier about it being October 2nd. When we shut down the building, this was presented to us as the option.
Mhm.
And we are not 911 dispatchers or administrators, right? So, or the sheriff or any else. So if this is not the viable plan, then what is recommended to us about the next viable plan? Or the next contingency plan on that? Or the contingency plan on that? So what we have is the rollover to Seneca and this Wasco plan. People seem to be looking to us to come up for a plan. It's not for us to come up with this plan or to come up with options. And I just want to make that very clear because people are acting like we're being neglectful of this. And we are not the resident experts, right? We rely on getting information to make informed decisions. So I just want to make that really clear. I feel like we're getting a little bit of the blame here about this and I'm not comfortable with that.
If the stations that are at the Owasco Fire Department aren't multiple, there's only 2 of them and they would need more. Is there equipment that could come from the first floor to a different site?
I've never heard about it.
I mean, though there are, it is, go ahead.
Can I answer that? So, okay, first and foremost, I don't feel like anybody's blaming, and I apologize if anybody feels like that. At the end of the day, the issue is having a location to put all of our equipment in. We don't have that. The Owasco Fire Department was presented as a short-term quick fix. Nobody expected this to be this long. So it was an immediate, what can we do quickly? We had a location to put a little bit of equipment for a short period of time. This would have never been presented if we would have known this was going to be this long lasting. It's not a good fix for any period of time.
So Denise,
The
it's
initial
also,
plan was to bring some of the equipment from the backup center to the Owasco Fire Department. That turned out to be not feasible. Jeremy couldn't make that all work. We tried everything we could. The issue with the laptops is new. I have been in a hospital. I was in the hospital for 2.5 weeks and sick for another week. When I got back, I found out they weren't working. This isn't something that I neglected. This is something I addressed as soon as I got back. So that is a new issue that I was not aware of. I am working on it. I told you I spoke with the vendor today. It's a very, very, very stressful situation, knowing that something could happen tomorrow and we don't have a plan. We need a location to bring all of our equipment from the COB to one location where everything is there together so that we have a solid plan. That's the only thing. I don't need anybody to tell me how to set it up. That's for me. You're right. That's for me to do, but I need somewhere to put that stuff.
And Denise, the location for this other equipment is not Owasco.
It's not. They don't have room for it.
Is that what this meeting that is being set up for, to discuss this situation?
It's an after action review of the 2 incidences that we've had since the close down of the backup 911.
When is that meeting?
I don't know if it's me.
Okay, I'd like to be part of that if I could, please.
I will let you know.
Okay.
any other questions for the sheriff or anyone? All right. Thank you, Sheriff.
Thank you. Have a good night.
Thank you too, sir. Riley.
After I want to follow.
Sorry, you didn't go home.
With that, I will echo the concerns that I appreciate the efforts.
That's why I saved you for the.
I know. I will echo everyone in this room that I appreciate the efforts happening on both sides of the table. My thoughts are particularly to the residents of Asheville, North Carolina, and the southern states that were impacted by the hurricane this last week. Should we just see a similar natural weather event, we're going to be underwater in more ways than one. So I emphasize, I appreciate the efforts on both sides of the table to trying to solve a very unique dilemma. In trying to move forward, and in trying to look at where we are from my office as well, I did present a report this month, and I just wanted to bring up some highlights and some changes since then. Namely, we did not see 146 calls. We're at 147 for the year. We actually had a rope rescue over the weekend involving King Ferry, Genoa, Aurora, and members of the Office of Emergency Services. We had a woman and a 12-year-old German Shepherd go over an embankment. They were about 60 feet of a waterfall from lake level. So we had a successful rope rescue over the weekend, and 12-year-old Emmy, the German Shepherd, was taken up with no injuries, no harm, no foul, and a sign off by the ambulance. So that's a positive. In our own unique dilemmas, I do want to say, while the sheriff is muted at the moment, I'm appreciative. We do have a temporary space for our office out at the sheriff's training facility. If anybody would like to come out and see our cube, you're more than welcome to. I've been working with the sheriff to look at some options for storage of our mobile equipment as well as with the highway director. And we're exploring some options with that dry storage building that's attached to the training facility where we are currently. On top of that, we have a number of trainings that are ongoing that are all very exciting. But I want to round out with a positive here tonight, and that I've talked with Chairman Anna. We have approximately 3 new units or new to us units that will be in service by next month's JPS meeting. So around 3:30, I'm going to extend the invitation to the committee as well as all of the legislature. Our 2023 rehab unit is in service as of last Friday. Our new to us heavy rescue should be in service a week from this Friday. And then our extended deployment trailer, shout out to Kathleen. It belonged to the health department and has been in service for a couple of weeks now, is also in service. And we've been very creative in trying to find low cost solutions to bringing new resources to the county fire and EMS divisions. So I plan to bring them right here, park them right outside, along with my special operations team leaders that are assigned to those, to answer any questions and give you guys the full tour. So I wanted to extend that opportunity to you all as well without taking up a presentation time.
When is that, Riley?
Next month.
Okay, at the JPS.
3:30.
Okay.
I
All right.
plan to have those units here so people can have a quick tour. And for those who don't know, next week is Fire Prevention Week. Support all of your local fire departments. So that's my last plug, unless anyone has any questions.
Well, I look forward to seeing the trucks.
They'll be here.
The sheriff gave us we had a fun day down there. I got exposed to CX gas, the whole thing, right?
I'm
But,
not gonna expose you to anything.
well, that's okay.
Other than hot air, man.
All right.
Any questions for Ryan?
All right, I appreciate it.
Thank you, Riley.
Thank you.
All right. District Attorney.
All right, thank you. I do have a presentation and I promise it'll be brief. I have a couple handouts just to explain the initiative that I am looking to present to all of you. And Health and Human Services, I'm sorry, I apologize. I feel your pain, so I'll be brief. We'll see if we can get it up. But in the meantime, next month, I am going to be putting a resolution on once the position goes through civil service and the whole process for a part-time Community Accountability Board coordinator. It'll be fully grant funded through the Gun Involved Violence Elimination Program. It's about approximately a $15,000 stipend, very part-time position, but necessary to implement this program. So I am very much looking forward to that. If you could just put it, full mode. Thank you. So the Community Accountability Board is a program, an initiative that they have in several other counties through the district attorney's office is how it's usually funded. And we're very lucky because DCJS approved this community initiative through the GIVE grant. So they will be able to fund that coordinator position, which is great. Essentially what there we go. What the accountability, you can't read that at all, but that's okay. What the Accountability Board does it's an alternative sentencing option for nonviolent quality of life offenders. So individuals who commit petty larcenies, criminal mischiefs, low-level misdemeanor offenses. It's really a program created to give the community a voice in the criminal justice process. So rather than expend the resources for incarceration, we're looking to get these individuals to kind of identify the harm that's been caused by their actions to the community and give the community a voice in how to repair that harm. So it provides an opportunity for concerned citizens to address offenders who commit those type of crimes. And then they would, the board is going to be comprised of, we were going to do 5, but I think we're going to do 6 individuals. Those are going to be community members in the city of Auburn. Our pilot program is going to be based in the city of Auburn first through Auburn City Court. Judge Thurston has agreed to help initiate this program, and he will be the judge for this. So essentially, we're going to focus on individuals ages 18 to 25, and I call it I'll refer to it as the Juvenile Accountability Board. It's not really juveniles. The lowest my office can go is age 18, and that's why we're starting at age 18. And that's not a hard and fast rule. If there's a 30-year-old who we think is appropriate for this program, we will recommend them to participate in the program. The board members are comprised of individuals who either live, work, or have a vested interest in the city of Auburn. My goal down the road eventually is to hopefully, if this pilot program is successful, have a community accountability board up in the northern part of the county and the southern part of the county as well. But we'll see how this works out first. So it really is focused on the principles of what I call community justice. And in that handout, I gave you exactly what I mean by community justice. It's a not really restorative justice, but it's similar in the principles. So that is very small from here. So basically it provides victims an opportunity to be heard too. So what happens is an individual will get arrested, for example, for a pet larceny. They don't have much of a criminal history or they have no criminal history. They'll go into Auburn City Court. The judge, the defense attorney, and an assistant DA from my office will say, hey, this person seems like they'd be great for this program. They will refer that individual to the board members, and the board members will meet with that individual and come up with a reparative agreement. A reparative agreement could be anything from, it's gonna have to include some type of community service, but paying back restitution to the victim, doing vocational training, drug and alcohol, mental health treatment, educational treatment. It could be something as simple as one of the duties they have to do is the board members will help them fill out an application to BOCES or an application to Cayuga Community College. So the goal is essentially to get those individuals to go through the program and not reoffend. I've seen too often, and what we see quite often is someone gets arrested, they go to court, it's a revolving door, they'll pay a fine, they'll come back and they'll commit a new offense. And there's really no reparation made to the victim, nothing to the community. And the individual, quite frankly, doesn't get on the right track, doesn't get on the right path. So our goal is to also establish individuals. So we do have 6 community members that I have met with. This is going to be a joint initiative between, it's going to be between our office, the sheriff's office, the Auburn Police, probation, assigned counsel, and then this CAB coordinator, the Community Accountability Board coordinator. And I just want to talk a little bit about what the coordinator would do. That person would essentially serve as a the district attorney's office or any of the executive committee members to have a huge role in the board determination as to what they think is appropriate in that reparative agreement. We really want the board to sit down with those individuals, come up with a plan. The victims are allowed to come in and express how that person's actions affected them, how it affected the community as a whole. And we're hoping that this will give much more of a voice to not only the victims, but the community members, and then put the person on the right track. We don't want them to consistently reoffend. If you're stealing, we want to know why you're stealing and how we can fix that versus consistently seeing you in court and potentially you going to jail or probation, expending probation resources, or just simply getting a fine. It just depends. But the coordinator will attend the monthly meetings. They're going to be monthly meetings. They'll be responsible for tracking participant compliance and providing updates to the court team. They're going to be kind of a supervisor of these 6 board members. So they'll come in, they'll kind of coordinate each monthly meeting. They'll communicate via email with everybody. And then what the board members are required to do is every month after the initial intake meeting, they're supposed to send an update to the court. This person completed this task. They completed this task. Here's their reparative agreement. Here's the plan for them. It's completely voluntary. So if someone's participating in the program and they say, I don't want to participate anymore. I don't like what you plan. Well, they go back to the traditional criminal justice system and they face probation, incarceration, or any other potential sentencing option.
So that's what's in it for the individual.
Exactly.
They get out from under this criminal charge and whatever action the court would take.
And if they're successful and they do everything that the board asks of them over a 6-month period, and that can be extended a little bit longer if the board wants it to be, that'll eventually get their case adjourned in contemplation of dismissal, meaning that at 6 months from that date, if they don't get rearrested again, their charges will get dismissed.
Yep.
So that's pretty much the goal of that. Let's see if I can come up with a chart. So I talked about who would be on the board. It's essentially community members. They have to go through a background check. It's completely voluntary. They're volunteering their time just to kind of better the community. The only individual that would receive any type of compensation is going to be this coordinator position because it is going to be a lot of work, especially getting this kind of up and running. So they're going to be that liaison person. The board's going to focus on what happened, who was harmed, and how the harm can be repaired. And then they come up with that contract. So those are the key players. The court team is a separate team. That's going to be the judge, assigned counsel, and my office. And then just getting to the start to finish, you'll kind of see how this goes. So they start out in court, they get arrested, they go to court. Then if they're chosen to participate in the board, they'll go to the initial intake meeting. Then they'll attend any type of meetings, monthly meetings that they're required to attend. Eventually, they'll complete all of their tasks and then they'll do their exit interview. And at that point in time, the board will send a recommendation to the court saying, they were successful, we recommend an ACB, or they didn't do what they were supposed to do, please bring their case back to the traditional criminal justice system. So that's essentially what the program is in a nutshell. I know that was a very quick overview, but I do hope to get this up and running by January. We were a little bit set back by civil service last month. It's on again for them to review. I think they're just reviewing the minimum qualifications to get this position going. But we have chosen a coordinator. That person has accepted pending resolution before all of the members of the legislature. And then the 6 board members have also agreed to volunteer their time for a 1 to 2 year period. And we're going to decide on the exact terms. We're not sure how long a term for a board member is going to be yet. That's something we need to discuss. I have a training scheduled for all the board members and the coordinator at the end of October.
Other counties have some of these things?
Yes, it's common in bigger counties. So larger counties, they have implemented this for over a decade. So this would be new to Cayuga County. It's something when I came in 2 years ago, 3 years ago, I really wanted to implement. Unfortunately, it kind of got put on the back burner, but now the fact that we have GIF funding for the coordinator, it's the time to do it.
And there's no requirement to do it and use this give money, but it's eligible to be used for that purpose.
So we need to have some type of community youth outreach through the grant funding, and this would fulfill.
Okay, you haven't, yes.
I've already gotten that approved from
Yep.
PCJS, this program, so that would.
This meets one of their
This
requirements.
meets the requirement.
Yep.
Any other questions? Anything else for you?
No, that's all I have.
Thank you.
guys so much.
That was great.
Appreciate
Thank
it.
you. Appreciate it. Anything else tonight, anyone? Can I get a motion to adjourn?
Make a motion.
Second. All right, moved. All in favor? Aye, we're adjourned. Thank you very much.
You're on JP?
HS to order. I know Legislator Jonathan Anna is in the room somewhere on his way. Legislator DeVito is here. Legislator Petcher here, and Legislator Strong here. First thing I'd like to do is approve the minutes from our September 4th meeting.
Make motion?
Move it.
Thank you. Any discussion or questions? Hearing none, all in favor?
Aye.
Any opposed? It's carried. Thank you. We have a series of appointments. These are for your information only tonight. 2 to the Community Services Board, Elizabeth Signorelli and Andrea Hansen. We also have a Board of Health appointment, Dr. Leah Weinberg. So committee reports, Kathleen Cuddy.
Madam Chair, before we
Yes.
go on, do we have an agenda, an extra one somewhere?
I don't.
I can get.
I have one right here.
Oh. I don't mean to be rude, I'm sorry.
Oh, that's fine.
All right.
I thought.
Thank you.
Get back. I'm gonna write it down, actually.
Oh. Okay, this works.
So we know you have one resolution before us. If we can review that first and get through that, and then we can have you date us.
So my request is for permission to go up to bid so that we are able to advertise for a company, an agency that can help us with our lead renovation and repair grant. And that is the funding that we got through the state to replace windows and doors in qualifying homes.
Can I ask for a motion to put 10-4 HH1
I'll move it.
or 10-24 HH1?
Motion.
Second.
Thank you. Any questions, discussion? Okay, hearing none, all in favor?
Aye.
Any opposed? Approved, thank you. Carried.
A few updates, nothing too heavy today. We've had some fun this week and into next week. It's walk to school day. We started at Millard Pilmer Elementary School today in Moravia. And there were 190 children that took part, and 75 of them turned in their scavenger hunt, which is a safety search for the stoplights, for the stop signs. And it's a really great way for to promote injury prevention and pedestrian safety. We'll be at Weedsport, we'll be in Fort Byron, and then all the Auburn elementary schools as well. So that's a lot of fun. We've also been attending school open houses, early intervention, place-based resource night, community action program, Head Start Healthy Family Fun Fair, we'll be part of, as well as, Riley mentioned with Fire Prevention Week, Healthy Neighborhoods is partnering with the Auburn Fire Department for Fire Prevention Week. They're going into Auburn schools to promote fire safety. They'll be attending trunk or treat events with the AME Zion Church, East Hill Family Medical, City through Falcon Park. So that's great to get out and go to some different events and engage with our youngsters in the community. Lead Poisoning Prevention Week is the 3rd week of October. We'll be doing some visits. Our prevention coordinator will be doing some visits with pediatric offices and providing some information firsthand. And I believe the legislature may also be offering a proclamation at the legislative meeting. Environmental health is winding down a lot of their summer work. Many of the summer events and temporary events and early fall things are quieting down, but as we all know, the work doesn't stop. Harmful algal blooms, ongoing monitoring happening. Thus far, our drinking water is in good shape. You would all be aware of it. And then early intervention. The state is switching their database. They are closing out at the end of this week what's called the New York State Early Intervention Information System. And in 2 weeks' time, we'll be starting up the EI Hub, they call it, Early Intervention Hub. So it's a new program that everybody, all the early intervention service coordinators And all the health departments will have to monitor to input all the demographics, who providers are, who the children are, what services they're receiving, things like that. So our staff has been attending some trainings for that. It has been something that was delayed for a couple of years. So I think everyone's excited to finally see it come to fruition and get it going. That's all.
Thank you. Any questions for?
I know
Legislator Allen?
yeah, thank you, Kathleen. I know we're getting towards the end of the season, but do you have any update on Triple E?
I don't have any further information. I was just at a conference last week. We had a lot of discussion about that. As you're probably aware, the state health commissioner declared Triple E as a threat across the whole state. We've had a lot of discussion about means to address it. I know that there's surveillance that's done. We also know that it's here, right? So there's plus minuses to that. We're really focusing a lot on education and probably refreshing how we educate people again. We've had a great commitment from our school districts where we've sent home every May, June information about, ticks and mosquitoes and prevention aspects, which is very useful because we know, particularly amongst the younger kids, their families typically open their folders and look through the stuff, so it should get home. But I think for us, in addition to our social media, having the attention brought by news reports has been a good refresh for the adults in the community. And it was very unfortunate that there have been some humans that have had Triple E, not in our county, other counties in New York State. And I think, that's an unfortunate reminder that brings it home to us.
And just to educate me a little bit, because I'm not that smart. Because we had a bad Triple E this season, I'm hoping we have I hate to say it because I'm not a fan of cold weather, but I'm hoping we have a very harsh winter to kill off mosquitoes. But if we don't, and we have another warm season, are we anticipating even worse Triple E season potentially next year? Does it kind of carry over, or how's that work?
That's a great question. I don't know that answer. Okay. I don't really know a lot about the life cycles and what feeds into that. I'll see what I can find out.
Yeah, I was just curious.
And I expect that we'll probably get a lot more information from our state partners as well. We do have, great resources in Oswego County and Onondaga County and Wayne County because they have dealt with this more directly as far as doing spraying in certain areas.
Yep.
And they're very specific. So I anticipate that they probably monitor this more closely. And I think with the surveillance that Oswego and Onondaga do, they probably have some better insight that we can see what we can learn. That is one of the things kind of on our list to look at more through our winter months so that we are a little more prepared.
Well, we're in a public meeting, so I just want to say thank you for your efforts and for your time for this. And I think you guys do a great job down there at the Department of Health. So thank you.
Thanks. I think everyone does too. Thank you.
Thank you. I'm going to move a little differently on the agenda so that our resolutions stay in order. So that means I will have Christine Bianco with Social Services up next.
This is different. Excellent. Okay. Of
Sure,
course.
absolutely. Be comfortable. So you have two resolutions. And if we could go through those first and.
So I have two resolutions. HH2 is a resolution for us to enter into a contract with Cayuga County Mental Health for the reports and assessments that they complete for children that we have placed in residential treatment centers or children in foster care. This is a renewal of a contract that we've had for a number of years. We are obligated to have folks that have certain clinical qualifications provide assessments for children that we have in that setting. And the reason for that is to have a clinician weigh in on their level of need for that high level of care. So Cayuga County Mental Health has done these for us for a few years, and we're looking to continue to enter into that contract with them so that we have someone to mobilize when we have the required assessments that have to be completed by a qualified individual.
Thank you. A motion for HH2?
Move it, Mark.
Thank you.
Second.
Any questions, discussion, details? Hearing none, all in favor?
Aye.
Any opposed? Carries. HH3, amending your budget to accept some funding.
Yep, so we're looking to amend our budget to accept funding for the shelter arrears eviction forestallment program, the safe SAEF program. This is something new for us. There was, I believe, about $10 million that the state appropriated for this program. We received an allocation of nearly $70,000. And this money will be used to, for rent arrears for people to remain in their permanent housing. So there are a number of qualifiers for folks to be able to qualify to receive these funds. They have to be on family assistance or safety net assistance. They'll be screened for that, and if they're eligible for that, and we can provide up to 6 months of rental arrears payments to help keep them housed in their permanent housing. This will be very nice and definitely will be utilized. We have a similar program that we have. That's we have a contract with CAP, and we actually ran through the money that we had allotted for that. So this is nice to be able to have another pot of almost $70,000 to utilize in this way to keep folks in their housing that they have currently have.
When the, oh, I'm sorry, yeah.
I'll second.
When the funds are exhausted, the program ends.
Yeah. This program.
Right, that's what I'm referring to, the
Yeah.
resolution program. Right.
Was a first-time funding offer to
Yeah.
you and
Hopefully this is.
certain pot that's spread across the
Hopefully
state.
this will continue. There definitely is a need, and this is what we've been seeing, and I've been talking about over the last few months. We've been seeing these allocations for certain programs come to us that never have before, and a lot of it is around providing, services to people that are having trouble with maintaining housing, are homeless. So this one came our way.
Any other questions? Any discussion? Hearing none, all in favor?
Aye.
Any opposed?
Yeah.
One opposed? Carries. On a report.
Just wanted to touch on a few things, not really with county leadership, Sharina Drosko and Steve Lynch, the IT department, to talk about plans for the 63 Genesee Street space. We had a meeting yesterday and actually done a lot of prep work for that meeting yesterday with providing information to the team around our space, worked on with IT, with our, what our current situation with our IT equipment, what we'll be going forward. So a lot of, effort being taken to make sure that we have the information ready to give to the architect. Meeting happened yesterday, first meeting to kind of go over all of that material. It was a good meeting, a lot of good discussion. So just wanted to let everybody know that that's moving forward. We have 12 vacant positions still in DSS in a variety of areas. We are seeing some positive success. We have a full-time paralegal that will be starting mid-October. And just today, we offered the director of fiscal management position to an internal candidate, and she has accepted. So we're moving forward in a positive direction in that way as well. And I wanted to let you know that. We are nearly done with all of the components of our Child and Family Services Plan, the 5-year plan that I talked about over the last couple of months. We had our public hearing in towards the beginning of September. And that was we had a good turnout of various community providers, service providers, and good discussion around the issues that are happening around child welfare, foster care services, preventive services, adult services. And honestly, out of some of that discussion, we came up with some low-hanging fruits of things that you can do, with other providers to make some positive changes. Just having people there to remind us of different resources that are available, was really, really good discussion. So we're submitting kind of piece by piece our components of that plan to the state. Received some approvals already for certain sections, and that it's been a lot of work, and we're working through that. Our emergency housing numbers as of last Friday, we were providing 34 families with housing. Emergency housing and 115 individuals.
115?
115,
Thank you.
34 families. Numbers are staying pretty steady. I'm saying that for the last months. And that's, I'm saying it again this month, that our numbers are remaining pretty flat.
Is the average stay about this, is consistent as well, or
The what?
the average stay, is that consistent?
The average stay recently is high, you know, and has been high, and that's really attributed to not being able to find the housing for people that have very low income. Continuing to with that. That's not changed for a while. So that's where we are with emergency housing numbers. And then I already talked a little bit about the shelter arrears program. I think that was the resolution, so I already spoke about that. That's all I have, unless anyone has any questions.
Any questions?
I was invited to come sit at the intake window. Don't tell them, but I might show up Monday morning. So I think 9 a.m. they open.
Mhm.
Yeah, so.
8 a.m.
8 a.m. All right, so
Yeah.
I'll have to be there bright and early, but yeah, that'll be a surprise, so.
Okay. Awesome.
Don't scare them, and I know they don't watch the meetings.
They don't do.
Oh, well, there's a warning, so they got it.
Legislator Strong?
Hi, Christine. You said you had a few positions that haven't been filled, whatever it is. Is any of those, and I'm just wondering if any of those are like a seasonal position? I know last month we talked about in the county, there was 600 and some odd positions available. A lot of them were seasonal. Are any of your positions seasonal, or are they just full-time jobs that we haven't been able to fill?
So our, in DSS, we have seasonal positions that are in the heat area, the heating and emergency assistance program. Those positions are full. We have people coming into those. They're actually working out of the CAP agency. We have 2 that started already, and we have 2 that are coming on board within the next few weeks. So those are our seasonal positions. The rest of them are not seasonal positions that we have in DSS.
So you have about 10 to 11,
So our vacancies right now, we have 12.
12?
140. 12 out of, yeah, around 140 positions. Yeah, we have 12. And some of them are in our accounting area. We have 4 that are in our children and family services area, 3 caseworkers, 1 senior caseworker, 2 human services examiners. And then we have trying to find a transportation aide that will work in the family services area, and then the attorneys.
Thank you for that information.
Thank you. Any other questions, discussion outside the committee? Thank you, Christine.
Thank you.
Lauren Walsh is on leave, and in her stead, we will be hearing from Maureen in the next few months. So Maureen, like the department heads ahead of you, let's look at the mental health resolutions first. We have 1, 2, 3, 4, 5. We just had a very late edition of HH 10.
Yes.
So start with HH 4.
Okay, HH4 is for Cape County Mental Health to contract with Qualifax Systems. Qualifax Systems would be updated to our electronic record. Our current electronic medical record is out of date and is no longer supported after November of this year. That current medical record is service-based and is considered obsolete technology. And we would be entering a contract for a newer product that is all cloud-based. We vetted 8 different electronic records, narrowed it down to 3. All 3 were in the same price range. So Qualifax checks all our boxes. It minimizes compliance issues. It has a great checks and balance system, and it has an integrated billing component, which is essential to the day-to-day activities of the mental health center.
Can I have a motion for HH 4?
I'll move it.
Put it on the table for discussion. So you said that there's multiple programs available and their price ranges are all the same. So this is the one you selected.
Yes.
And did that go through Amanda's office? Did she work on this with you? And
Yes, I know that there was
Purchasing.
coordination with all county departments. We were given two options, including a chair waiver.
okay,
And before Lauren went out on medical leave, she met with the legislative chair and a chair waiver was approved for this.
and in the other program, this one says it goes up in an annual increase of about 5%, where the other one's about the same.
Yeah, everything is kind of on par, especially because of the need for increase in technology.
And does this come with support as well?
Yes, one of the driving factors was that ongoing support and interaction from this particular company. They have a long history with doing behavioral health electronic record, which is a very specialized component when you're looking at electronic records. It's a particular part of medical records. And what's also great about this one is the integration of billing, which is a key kind of function.
Any other questions, discussion? All in favor?
Aye.
Aye. Any opposed? Carries. HH5,
So we are asking to fill our full-time psychiatric nurse practitioner position at Cayuga County Mental Health. Last month, we asked to fill for a staff psychiatrist. So we would just ask to make an amendment to the previous resolution to defund in order to hire a full-time psychiatric nurse practitioner. We had an ad out for about a month for a full-time staff psychiatrist and got 0 resumes. We do have a current nurse practitioner that is interested in coming forward to work at Cayuga County Community Mental Health. One of the big pros to switching to a nurse practitioner is a cost savings of around $54,000 a year with hiring a nurse practitioner over a psychiatrist. We've also consulted with the New York State Office of Mental Health to ensure that we're in all compliances with OMH standards for quality of care, and we are able to operate with nurse practitioners. We also still have a contract with Dr. Pratt's as a contract psychiatrist and a locum contract with Upstate for additional psychiatric services if needed.
Motion. So this allows you to still do the 7:30 evals and the physician holds?
Yes.
Okay.
So Dr. Pratt's, it would.
He'll be supervising physician over the NPs.
Absolutely. Yep. And then we also have that contract with Upstate for any additional needs with 7:30 evaluations.
So there's no drop off in services and still saving about $47,000.
Yes.
Okay. Thank you.
what we would need to do, what I'm suggesting that we do, not with this resolution, but in time for Ways and Means, is that we go back to 924 HH9, which is where we made the resolution to fill a full-time staff psychiatrist. And we rescind that fill and we defund that position.
Yeah, because I was going to actually suggest that we amend this to abolish the prior position of the psychologist or the doctor or. So.
But there'd be two different things happening in one resolution. So you're.
Well, no, my thought process, I have no problem filling the MP position, but I don't believe we should leave the other position pending, even defunded. I would like to see it abolished. And then down the road, if they ever wanted or had the need again, they could always go to the Civil Service Commission and reestablish a position. It's, you know, when we talked the other day and Diane's like, oh, we have 400 and some positions. Well, we really don't. They're defunded, they're not being used, but we have those titles out there. And at the end of the day, I don't think it's in our best interest to add another title just floating out there. I'd rather see the position abolished and appoint this position in its place.
Well, I was gonna say, if we're gonna go back and revisit that resolution, we could table this until that meeting.
So the proposal is to table it to Ways and Means. I'll put together a resolution that repeals the HH9 from last month and defunds it. And then we'll have that one on the agenda first and then this one. Is that what the proposal is?
Yeah, I would support that.
That would be my suggestion, yes.
Okay, I'll get something together and then we'll get it back on the agenda.
And will that will the wording be in there for what legislator Anna wanted was
Abolish versus
abolishing.
defund.
Can we put all that in the new resolution?
If that's what this committee wants to do is abolish it,
I would ask.
we could do
Yeah,
that.
I would,
It's up to this
I would.
What is the
that's what I would
feeling of the
prefer.
committee?
I would support that.
I would prefer that, yes,
Okay.
to abolish the prior position and establish this one.
I'll draft the resolution for Ways and Means.
So I'll make the motion, we table this and, table.
I think it's been.
I made the motion. You can.
I'll second it. I'm sorry. You made it already. I'll second it. Sorry, Mark. There we go.
No, that's fine.
That's okay. Yep.
So just to be specific, this is being referred to Ways and Means.
Correct.
Yes.
Thank
Correct.
you.
Yeah, we're not, yes.
Is that?
You're gonna get it. It's just. Don't get too excited.
Okay. Very good.
So all in favor of tabling HH5?
Is it a table or?
It's technically a referral.
Technically a
Refer to-
referral. Yep.
It's a table referred to Ways and Means.
That works.
That
works.
Aye.
Aye.
Any opposed? Carried. HH6.
Okay, HH6 is just allowing us to enter into contracts for the SAMHSA Assistance and Care Sustainability Grant, which is the case. This was presented probably about a year ago, accepting the funds. The initial resolution did not include how that allowed to contract with outside agencies. So this allows us to contract with outside agencies and
Make a motion.
Thank you.
Second.
Thank you. We have a motion and second for HH6. Any questions, discussions? Hearing none, all in favor?
Aye.
Any opposed? Carries. HH7.
it says to authorize the filling of a full-time help staff social worker position at Cayuga County Community Mental Health. We had somebody start and was offered a job with the state and resigned the second day, so.
I make a motion.
I'll second it for discussion.
Thank you.
So I guess that's all right.
Mhm.
So I want to be correct on this. So it is budgeted
Yes,
and we had somebody, they resigned.
Yep.
And now we just need to find somebody else to fill it.
yes.
Thank you.
Any other question, discussion? Hearing none, all in favor of HH7?
Aye.
Any opposed? That's carried. HH10 is newly added. This is authorizing the filling of a full-time crisis intervention case manager position at the County Mental Health Center, Community Mental Health Center. This is specifically, we've talked about this a lot over the last couple of years, but this case manager is specifically part of the mobile
Yes.
crisis outreach team.
Yes, it's an integral part of the mobile crisis team. The mobile crisis team is a two-professional team and includes a licensed social worker as well as a case manager. The case manager is very valuable at doing post-mobile crisis follow-up, linking individuals to additional services, helping with transportation, and really allowing for that post-vention follow-up.
Can I have a motion? Motion.
Second.
I'll second it for discussion if it's possible, or a question for that.
Discussion?
Your mobile crisis team, well aware how busy they are. Are they just specific hours during the day? Are they working full 24 now? What's their hours?
The current mobile crisis team, the team that's operated out of the clinic is Monday through Friday, 9 to 5. And then the county still sustains the contract with Liberty Resources to do that after hour mobile crisis, which is 5 to midnight, Monday through Thursday, and then 6 a.m. to midnight, Saturday and Sunday. At this point, we do not have 24/7 mobile crisis in the county. It is on our local service plan now.
Thank you.
Any other questions, discussion? Hearing none, all in favor of HH10?
Aye.
Aye.
Aye. Any opposed? You have updates for us?
The clinic has been very busy with open access. I can give you a good update on the DDT and school SAMHSA Assistance and Care Grant. There will be a training. It's going to include 3 rural school districts. It was really important for us to do increase mental health access to the rural school districts outside of the city of Auburn. So we will be having Union Springs, Moravia, and Cato sent teachers to be taught in how to implement DBT skills right into the classroom. So it's an initiative that we're really excited and proud of to really expand access outside of the clinic.
Is there an age group? Is this more high school, middle school, elementary?
They are targeting middle school for a lot of different reasons. Just that developmental age really benefits from social emotional education, but also from a logistic and implementation standpoint. It's much easier for the teachers to implement into a middle school classroom. Their curriculum does go 6 to 12. And what's great with the SAMHSA Assistance and Care Grant, it's a 4-year grant. So we'll be able to have multiple years of implementation, include other school districts. And what they're telling me is that there will be an elementary curriculum available in the spring, which is very exciting to include an evidence-based social emotional curriculum into the elementary schools as well. We're seeing a lot of increase in referrals for some of the younger kids through FAST, Families Access to Service Team. So it's just a great way to wrap around social emotional supports in all levels in our community.
Can I just clarify the name of that program again?
It's called DBT in schools.
DBT.
Yep, dialectic behavioral therapy.
Right. I'll stick to D.
Yeah, that's what I was gonna say.
You can tell I'm the project director for the grant, so it's something I'm very proud about that we're able to offer, and I've been more excited to kind of focus on the rural districts and really kind of get some good data to kind of present to you guys, hopefully in a year.
Thank you. Anything else? Anything else to report? Okay,
Sorry.
thank you.
No, thank you very much.
Yeah, thank you.
Thank you.
Thank you.
Brenda, I'm in the Office of Aging. You have one resolution tonight.
And handouts
Okay.
with goodies.
I don't know what to make of this. You're handing me resources for older adults. Sure.
Mostly for your constituents.
Okay. I mean, I'm on the other side of 50, so.
Your baby.
Okay, let's start with the resolution, HH8.
So this is another revenue source for us and a way to provide additional services. What involves the contract with the Alzheimer's Association for a certain amount of funding and use that to pay for aid service, respite service, for respite in a nursing home, whatever else that set up for an individual to provide the caregiver in the community a little bit of a break. So this is very straightforward, bringing money from expanding services.
Move it.
Second.
Any questions, discussion about the funding? Hearing none, all in favor?
Aye.
Opposed? HH8 carries. So reports for us along with
So I brought
information.
you some materials, yellow book. We have produced from the Office for the Aging for probably a couple decades or more. We condensed it down a little bit due to short staffing for the last several years. We were delayed in getting it reprinted. We get lots and lots of requests. It's a nice basic resource to look things up quickly for older adults in the community. While our population more and more is using the internet, we still have a very large percentage of those that use our services that want it in writing, something they can look at. I don't think a week goes by where somebody doesn't say, I wish there was still a phone book who comes into our office. So we still produce these. We're about 400,000 and we've already given out at least 500. So we'll probably need to update it and do another printing before too long. The public, we had our senior fair on Wednesday. I'll give you a little more info about that in my next report for next month. I'll have a little bit more details, but we did have well over 400 people participating out at the mall. You can see all the vendors listed on the back here that had signed up to attend the event, the different programs and things that we offered during the event. Lots of positive feedback. People really loved that event. Once again, our vendors were just blown away by how many people attend. They ran out of all the materials that they had brought long before the event ended. So it's just a phenomenal turnout. I can tell you for our staff, it's a lot of work. Tuesday afternoon, we filled 3.5 SUVs with just stuff from our office that needed to go out there to make that event happen. Everything from the PAs to materials to tablecloths to just endless things. So it's a huge commitment for our department, and it's wonderful the way the community enjoys it and gets so much out of it. So I wanted you to have that. And then the green brochure is the public hearing that we have also out of the mall, as we're required to be for our funding. And this is just a nice way of summarizing some of the services we do, our budget, just a little bit of everything really super condensed here into this program. So anybody has any questions about any of these things, they represent a lot of work behind them, and really, you know, always with our goal of getting information and services out to the older adults.
Are you still getting positive feedback for the Go Grandparent app?
So GoGo Grandparent, I'm kind of thinking, yes, we are, to be the short answer. GoGo Grandparent is the transportation option. We have had approximately 10 people. I think it's a little bit more than that. Again, I was going to report a little bit more on that in the next couple of meetings, but we've had a successful trip. I think Syracuse, Rochester, Ithaca, some within the area to get to Auburn appointments. So it's doing pretty well. Yeah.
Is it being underutilized or you think it could be utilized more? Is it being utilized over?
Yeah.
You only have so much grant money, right?
Yeah, we have some sufficient grant funding, I think, for the need at the moment. We're still feeling it out in terms of the Uber capacity in this area. So we're still trying to oversee it very tightly. We're trying to ensure that people get back to their homes or on their way back before we leave at the end of the day. It's not like living in an urban area where Uber is readily accessible. So
I'm guessing it's being utilized by more of the people on the outstretches of the county, maybe, or is it even in the donut towns?
in Auburn that need to go to Rochester or Syracuse.
Okay. They're still having difficulties possibly getting back.
Getting more.
There's still potentially possibilities of difficulties getting return trips.
A little bit of concern.
Okay,
Yeah.
fair enough.
Yeah. I think it's very worthwhile for people to try. Again, as long as we can kind of monitor it and make sure everything's good. It's the only option sometimes for folks, so it's good to have an option. Especially in the winter. I can foresee it becoming even more of people will want to take advantage of it.
Anything else? Any questions for him? Thank you. Look forward to your report on the senior fair. And last, we have our Youth Bureau Director, Deborah Dennis, with one resolution. So let's take a look at HH9 first. This is a resolution to amend the budget to accept additional OCF funding.
On September 18th, New York State reached out to me. They had extra youth team sport funding specifically for the 2024 year. As you may recall, the youth team sport funding was difficult for a lot of counties to get people to apply for. So some counties had to turn some of it away to our benefit, because now we've received an additional $6,106 that we can add to our budget. I had a brief interaction with our youth advisory board, who to give that funding to, since I had to be committed by September 30th. It was a pretty quick turnaround. So what we had decided to do with the 5 programs that we funded for youth team sports specifically, 3 were Little League organizations who already received their funding for AEDs. So we split up the funding between the remaining 2 programs that we weren't able to fund their entire request. So this would be $3,106 going to the Booker T. Washington after school basketball program, and the other 3,000 will go to the Auburn Lacrosse Boosters Youth Lacrosse Program.
Right,
Move it.
Second it, Mark.
thank you.
And these are towards AEDs as well?
No, these are
No?
just towards like the team, just different aspects of their youth team sports, whether it's reimbursement for equipment,
Okay.
umpires, uniforms, scholarships, things like that.
But they had requested more money, you weren't able to
Yeah, so
fulfill
for
it all.
instance, I know Auburn Lacrosse had requested at the time $12,000. We were able to give them 8, so now this helps fill that.
Any other questions, discussions? Hearing none, all in favor?
Aye.
Any opposed? This carries, thank you. A report for us, Deborah?
Yeah, a couple of updates. First of all, with Student Government Day coming up on October 22nd, that will be the next time we have a legislative meeting to on Tuesday morning at 10 a.m. As of this time, our chairperson, Aileen McNabb-Coleman, had sent out the invitation to the 7 schools in our area. We have 12 departments that are able to participate this year. It is lower than in years past just because of the logistical concerns we have with spacing in many of the offices. But we still do have a good turnout for students that will be coming that day to shadow some available departments, but we will have more students at the legislative meeting this year than in the past due to some of those space constraints. As of the 7 schools, as of today, I've received 4 commitments out of the 7. And I have followed up and just waiting to hear back yes or no, at least for the 3 additional schools. And hopefully by next week, since all the forms will be back to me by October 4th, I will have the department list ready to go so that to let everybody know which students you'll be assigned and which departments they will go to. It's going to be a little different this year as well. Just again, based on normally we have the county office building drop off. So this year, the buses will be going to the overflow parking lot at the county office building to drop off one group of students that will be logistically located downtown. Another bus drop off will be at the Cayuga Community College, and then the third one will be at Emerson Park. Then they'll make that loop again to get the students back to Emerson Park for the luncheon that happens at 12 noon after the legislative meeting and after the students are done shadowing the various departments.
Can you tell me if Moravia?
The schools that have not is, I have not heard back from Moravia. I have not heard back from Southern Cayuga and Cato are the 3 schools that we don't have commitment from. But I did follow up with all of those schools again today and just at least ask yes or no, reminding them of the due date. And then if they're not able to participate, if they could let me know. And I'll keep you updated on that because I know last year you were able to kind of work with the principal and get us a couple more students.
I'll light a fire.
Okay, thank you. Yesterday was the additional due date for the OCFS New York State grant funding for our youth programs. I have received 15 applications so far, which is great. 5 of them are actually new programs who have never applied with the Youth Bureau before, so that's exciting for us. I have done an extension of that deadline to October 18th because there are a couple of other programs, so we're just really having a hard time being new to the process, getting everything back to me. So I am offering an extension till Friday, October 18th. I'm just going to be a little more, I need to be more strict with the deadline. Last year, we let it go until December, middle of December, before the Youth Advisory Board was able to meet and get all of the decisions made. However, this year by December 1st, I have to have all the applications approved to New York State. So just working on getting those in and approved and hope to schedule a meeting with our Youth Advisory Board the end of October, first part of November to make those decisions. And that's all I have right now. Any questions?
Thank you. Any questions for Deborah? All right, thank you.
Thank you.
That concludes updates from our department chairs and our resolutions. Motion to adjourn.
Move it.
Second.
Thank you. Favor.
Aye.
Aye.
Adjourned. Thank you.